Hello, my name is David Trimberger, and I am giving my presentation over our analysis paper that we are asked to do. My topic for this subject is going to be PTSD and first responders. I have a PowerPoint of things kind of set up on my iPad, so that is what I will be using to help give my presentation. So to start off, anyone has the capability of being able to gain personality traits of PTSD. So according to the Mayo Clinic, PTSD is a neurological disorder that occurs when a person has witnessed or is a part of a catastrophic or terrifying event, or one that manages to have one of lasting memory. So kind of following with that, I'm going to give a little bit more statistics. So whenever you think of somebody that has PTSD, majority of the time you are going to immediately think of somebody that is in the military. Well, that's not just the case. The other large sanctity of people that suffer from PTSD is actually first responders. The military and first responders actually make up over 90% of people who suffer from PTSD. The next 5% is sexual assault victims, and then the other 5% is just random and miscellaneous things that cause other people to suffer from PTSD. So I want to kind of provide somewhat of an example of someone who could possibly develop PTSD. So say you and your partner are going on a call. As you're on your way to the call, you get dispatched for a basic altered mental status. As you arrive, the patient begins to show signs of agitation, and before you and your partner notice, you fail to recognize that there is a weapon laying on the ground. Your patient begins to pick it up and start firing towards you and your partner. So after police arrive and you get the patient detained and everything is all good, you go on to your next call and you follow up with the rest of your day. So fast forward a few months later and you are now at the 4th of July party. So it's 4th of July, you're grilling, you have s'mores going, the kids are running around, everybody is happy and having a good time. Now night comes around and everybody starts to light off fireworks. You have the gun sounding firecrackers, Saturn missiles, and other things of the sort that end up causing this certain paramedic that was in this terrible situation to start to see flashbacks of the event that happened. They start to see just remembering all the anxiety, the pressure, everything that comes along, and it's just a surge of emotion that even though they know everybody else around them is happy, they feel the love of everybody, the only thing that they can personally feel is that they're back in that situation that happened previously. So what ends up happening is that person begins to kind of almost stand in fear, and they don't exactly know what to do other than lash out or run away. So the National Institute of Mental Health states that for someone to start to show signs of PTSD normally occurs within 3 months. So say that paramedic 3 months later, that's whenever things should start to develop. That's not always the case because yet again, anyone has the ability to show PTSD symptoms in which they can begin to start to develop within a few hours, or it may even take up to a few years for them to fully manifest. So for someone to be diagnosed with PTSD, they have to show at least one avoidance system, at least 2 cognition and mood systems, at least 1 re-experiencing, and at least 2 arousal and reactivity systems for over 1 month to be fully diagnosed with PTSD. Majority of the time, people who have PTSD also have anxiety. They're very easily startled. They tend to start to avoid everything. They lose an interest in kind of what's going on around them, and they have an inability to sleep because what ends up happening is they have very frightening thoughts, they get bad sleep, and they have severe flashbacks that kind of take them back to what the situation they were once in. So what can someone do if they have been diagnosed with PTSD? Well, PTSD is an internal battle that they mentally have to get over themselves. Even though it is very lonesome, there's not officially a whole lot of things that people can do, but one of the biggest things is to be able to take care of your mental character. So what that means is you can go and you can seek a counselor. And if you go and you seek a counselor, what they're going to do is they're going to perform psychotherapy tactics. They're going to do talk therapy. They could do group therapy for people who are going through the same situations. And later down the line, if they notice that things aren't getting better, they can provide medications that will allow for someone to start to alleviate some of the symptoms and get them back on track to living their normal life. So now kind of taking this back on to how PTSD affects first responders. So Ryan Kelly, who wrote an article, America's First Responders Suffer from Depression and PTSD, he interviewed over 40 different stations and he evaluated many more. He went to police, fire, EMS, and from his studies that he found, he noticed that within his clinical group, over 30% of the first responders that he interviewed suffered from PTSD. And on another side note, 37%, which some of them didn't even suffer from PTSD, have at least tried to commit suicide at one point because of things that they've been able to see in the field. So with this also kind of factors into a new factor. Instead of someone wanting to go and try and seek help, what they end up doing is they rather develop a substance abuse problem and just relabel what's actually going on with their mental character. So I actually heard this joke, and it says whenever a couple is dating, they say, oh, you don't need to get through their heart, you need to get through their stomach. Well, in a first responders world, it's you don't need to get through their heart, you need to get through their liver. So with that, with Ryan Kelly's article, he also puts that almost half of the male population states that they rather have created a substance abuse problem to help combat some of the feelings that they have suffered and seen from what they have done in the field. And same thing for the female population, it was over 37.4% from what he interviewed. So, and also from what he noticed is people who are suffering from PTSD and are also a first responder, they tend to show more uncharacteristic tempers. They also have a more severe difficulty concentrating. They have lower work performance because they don't want to go back out in the field and re-experience what has been going on. And they also have a more severe emotional distinction than someone who suffers from PTSD normally. So, as a population, what's something that we can do to be able to help someone who is suffering from PTSD? So Desert Parkway, which is a behavioral and mental health hospital, they say that what we need to do is we need to prepare. So in order to prepare, some of the things that we should do is whenever agencies have fully developed staffs, they need to make it to where they have a work relationship with counselors, and once a month, everyone from their department needs to go and at least talk to their counselor. That way they have that relationship already established, and if things ever actually do get rough for them, they can be able to go and talk to someone. Now, I personally feel that we could even take this a step further, and I think that we should already go ahead and as students do that exact same thing. So colleges and other programs around America or even the world should start making it to where as an extra credit reward, you go ahead and you already establish a relationship event with a counselor. That way you are able to kind of go ahead and get rid of the mental stigmatism that taking care of your mental health is kind of weird, but you can go ahead and even if you start seeing weird things on a clinical, you're not sure about what's going on, you already have a relationship established and counselors are able to help take care of things. Because one of the biggest things that Desert Parkway noticed was after the Las Vegas shooting event, they noticed that there was a severe lack of anybody going to go see a counselor in the first responder world. So another thing that Desert Parkway states is that some of the things that we need to do is to go ahead and teach the public. So most pedestrians, whenever they go and they talk to a first responder, the things that they say is, what is the worst thing that you have ever seen? That is a trigger thing that immediately causes someone to go through PTSD symptoms. So now, in my opinion, I think what we can do as a nation is we can be able to start to pull together, get more people to start taking care of their mental health, be able to work on the public to make sure that they're recognizing issues that is going on, and make it to where agencies are wanting to be more helpful in taking care of their individuals and also helping out our sanctity as a nation. Thank you for listening.